So now it's time for our audience to have any questions. Yeah. ខ្ញុំគិតយកទាំងអស់បើសិនបើមានសំណួរអាចលើកដៃឡើងហើយក្រុមការងារយើងនឹងជូន microphone ចាដើម្បីសួរសំណួរផ្ទាល់ទៅកាន់លោក Dr. តែម្ដងចាចាលោក Dr. មានបទបង្ហាញតាក់ទងទៅនឹងការព្យាបាលជំងឺមហារីកសួតចា Okay, I have a question in hand for you to explain more to our audience as well. So regarding early lung cancer, can an operation solve the problem?
Yes, early lung cancer should be operated from stage 1 to stage 2. Definitely, surgery first will be the best way to cure the cancer. Yeah. So if you taken it out, you send the whole thing to the pathologist. Pathologist will then properly stage the cancer, and then if it's what we call T1B and above, we can offer adjuvant medicine to treat the patient with the oral drugs.
Okay. Yeah. So it can be operated during the stage 1 and stage 2?
Yes, surgery first, and then we decide whether the patient will need more treatment later.
Okay, សំណួរសួរថាតើនៅពេលដែលយើងមានជំងឺមហារីកសួតដំណាក់កាលដំបូងតើយើងត្រូវឆ្លងកាត់ការវះកាត់ឬក៏អត់ហើយការវះកាត់នឹងអាចជួយបានកម្រិតណាដែរចាលោកដុកទ័រមានប្រសាសន៍ថាសម្រាប់មហារីកសួតក្នុងដំណាក់កាលទី1ដល់ដំណាក់កាលទី2គឺយើងចាំបាច់ត្រូវការវះកាត់ប៉ុន្តែនៅពេលដែលវះកាត់ហើយយើងនឹងធ្វើការត្រួតពិនិត្យបន្តទៀតថាតើត្រូវព្យាបាលយ៉ាងម៉េចបន្តទៀតផងដែរចា Thank you so much Doctor for the presentation. ចាភ្ញៀវកិត្តិយសទាំងអស់មកដល់វេទិការបស់ភ្ញៀវកិត្តិយសហើយបើសិនជាមានសំណួរតាក់ទងទៅនឹងបច្ចេកទេសនៅក្នុងការព្យាបាលជំងឺលើសគីឡូនិងជំងឺទឹកនោមផ្អែមចាអាចផ្ដល់ជាសំណួរទៅកាន់លោក Doctor បានចាចាបើសិនបើមានសំណួរសូមលើកដៃចាខាងក្រុមការងារនឹងជូន microphone ចាសូមអញ្ជើញ
Hello. បាទខ្ញុំឈ្មោះក្លឹមច័ន្ទមកពីខាងរដ្ឋសភាបាទហើយសូមអរគុណលោកដុកទ័រសង្កាដែលគាត់បានធ្វើបទបង្ហាញអំពីជំងឺទឹកនោមផ្អែមខ្ញុំមានចំណាប់អារម្មណ៍ខ្ពស់ណាស់ដោយសារខ្ញុំមានជំងឺទឹកនោមផ្អែម23ឆ្នាំមកហើយបាទក៏ប៉ុន្តែក្នុងហ្នឹងខ្ញុំចង់សួរលោកដុកទ័រសង្កាថាទី1សូមអធិស្ឋានគាត់ជនជាតិស្រីលង្កាឬក៏គាត់ច្រឡំគាត់ជនជាតិសិង្ហបុរីឬក៏គាត់ជនជាតិឥណ្ឌាឬក៏ប៉ាគីស្ថានទី1ទី2ខ្ញុំចង់សួរថាតាមការប័ណ្ណបង្ហាញផងគាត់អង្គការ WTO រៀបរាប់មកគាត់ថានៅស្រុកខ្មែរតាមការព្យាករណ៍អ្នកដែលកើតជំងឺទឹកនោមផ្អែមមាន 30% បាទក្នុងនេះខ្ញុំសូមធ្វើការចែករំលែកខ្លះព្រោះកន្លងមកមានគ្រូពេទ្យស្ម័គ្រចិត្តមកពីប្រទេសវៀតណាមព្យាបាលជំងឺតាមព្រំដែនគ្រូពេទ្យស្ម័គ្រចិត្តមកពីប្រទេសថៃគេបានព្យាបាលអ្នកជំងឺតាមព្រំដែនគេធ្វើការសន្និដ្ឋាននៅក្នុងពេទ្យគេនីមួយដោយសារចំនួនខ្មែរយើងដែលទៅព្យាបាលនៅប្រទេសថៃមានចំនួនច្រើនហើយបើគិតជាមួយឆ្នាំប្រាក់ចំណូលខាងថែទាំសុខភាពនៅប្រទេសថៃប្រហែលជា$300 លានក្នុងមួយឆ្នាំបាទហើយអញ្ចឹងគេធ្វើការសន្និដ្ឋានថាខ្មែរនៅតាមជីដែនរវាងប្រទេសវៀតណាមខ្មែរហើយនិងវៀតណាមថៃខ្មែរអ្នកកើតជំងឺទឹកនោមផ្អែមមានចំនួនដល់ទៅ 45% បាទអ្នកដែលកើតជំងឺដោយសារការហូបចុកអាហារឧទាហរណ៍សត្វខ្យងគេហៅអា berry អាខ្យងមួយយ៉ាង berry ហ្នឹងគឺប្រភេទខ្យងពណ៌ berry របៀបគេហៅថាពណ៌រៀងក្រហមព្រឿងហ្នឹងខ្មែរអត់ដឹងទេឲ្យតែខ្យងនឹងហូរចូលស្រុកខ្មែរយើងញ៉ាំទៅគ្រូពេទ្យគេតែនាំថាជំងឺហ្នឹងបើសិនណាជាមនុស្សប្រុសញ៉ាំខ្យងប្រភេទ berry មកពីវៀតណាមមកពីថៃកើតជំងឺពីរយ៉ាងទី1បរោះកើតជំងឺទាកទឹកឬក៏ជំងឺថ្លើមចំណែកស្ត្រីកើតជំងឺថ្លើមហើយនិងជំងឺគីសដុំបាទហើយចំណែកខ្ញុំចង់សួរលោកដុកទ័រថាបើសិនណាជាគាត់មកពីសិង្ហបុរីតើប្រទេសគាត់មានគោលនយោបាយយ៉ាងម៉េចចំពោះអ្នកកើតជំងឺទឹកនោមផ្អែមគេអាចផ្ដល់ថ្នាំពេទ្យដោយគេហៅថាមិនគិតលុយឬក៏យ៉ាងម៉េចបើគាត់ជាជនជាតិឥណ្ឌាតើប្រទេសឥណ្ឌាមានគោលការណ៍យ៉ាងម៉េចបើនៅប្រទេសប៉ាគីស្ថានមានយ៉ាងម៉េចហើយនៅលើលោកនេះប្រទេសណាដែលមានផលប៉ះពាល់ទឹកនោមផ្អែមច្រើនជាងគេដោយលោកគ្រូពេទ្យគាត់ប្រាប់ខ្ញុំលោកគ្រូពេទ្យដែលខ្ញុំធ្លាប់មើលជួនណាគាត់ត្រែកដំងថ្នាំឲ្យខ្ញុំចាប់ដើមទុនដៃទុនជើងញីញ័របើកឡានលែងកើត ឥឡូវនេះខ្ញុំបើកតាមម៉ូតូឯងខ្ញុំមិនហ៊ានបើកឡានតទៀតទេ
ចា
ដោយសារពេលដែលមានចុះជាតិស្ករបញ្ហាអីទៅខ្ញុំញ័រទៅតិចទៅត្រឹកអត់ដឹងអីទេ
ចាអរគុ
អ
ណ
ញ្ចឹងខ្ញុំខ្លាចបុកទៅគេ
ចាចាអញ្ចឹងមានសំណួរពីរសំខាន់តើតើគាត់ជនជាតិអ្វីហើយនិងសំណួរទី2តើមានគោលនយោបាយអីគាត់នៅប្រទេសគាត់ចាតកតងទៅនឹងការជួយទៅដល់អ្នកមានជំងឺទឹកនោមផ្អែមចាពីរសំណួរចាអរគុណចា
ឧទាហរណ៍ដូចគាត់អញ្ចឹងមកធ្វើបទបង្ហាញអញ្ចឹងគាត់មានអនុសាសន៍យ៉ាងម៉េច
ចា
សម្រាប់ផ្ដល់ជាមតិយោបល់ទៅដល់ឧទាហរណ៍ថាខ្មែរយើងកំពុងតែកើនដោយសារការហូបចុកមិនបានតាមពេលវេលាណា
ចា
បាទសូមអរគុណ
អរគុណច្រើនចា
បាទ
So Mr. Khlom-chan, he is a member of National Assembly in Cambodia. So he is really interested in your presentation, especially the figure about the percentage of population who get diabetes in Cambodia. But he just want to share another new figure that he got from the other group of researcher, which is 45%. So it's yes, a little bit higher than this percentage. Anyway, he just would like to ask about your nationality, like where are you from originally? Yeah, is it in Singapore or in other country? And can you share about the government policy in order to manage the diabetes population in the country so that he can learn from that as well? And what is your recommendation for the people to prevent the diabetes? Yes, thank you.
Thank you very much for the question. My grandfather's from Sri Lanka originally. So I was born in Malaysia, and I live in Singapore now. So, you know. The government policy in Singapore, diabetes is rising quite rapidly in Singapore. Over 20 years, from less than 5%, it's more than 10% diabetes, yeah? But in different ethnic groups, it is different. For Chinese people, it is about 7 to 8%. For Malay people, about 11%. For Indian people, about 17%. It's much higher. So there is a difference in different ethnicities. I think in the end, going forward, diabetes is a problem. This type of diabetes we're talking about is type 2 diabetes. Type 2 diabetes happens when we have too much excess body fat stored in the body. So it still comes related very much to how much we are eating. And that's why there are a lot of changes in Singapore right now in terms of regulating or advising people how much sugar is in the food and how much starch, fat, the nutritious content of the food. So we have some new labeling, which is identifying some food which is more healthy and some food which is not so healthy. So what's worked is to put a healthy label. So for example, if a shop is selling a few dishes, they will put a label on which dish is more healthy because the calories are lower, maybe more vitamins or nutrients, something like that. So healthy food labeling is one strategy that seems to be working today. Personally, what I can say is everyone needs to learn and understand more about food, what they are eating and drinks, and not just listen to commercials or advertisements. So I think we have some responsibility. In the past, we did that because we were farming our own food, growing, we have our own chicken, our own animals, and we're eating only from our family. But today we are not doing that. We are buying it from somewhere. So how somebody farmed the chicken or the produce that is being sold may not be the way that your family did it. So we have to be understanding about this and make sure that you are making the right choices.
Thank you so much, Doctor.
Thank you very much.
Presentation. I hope we have question from our audience. ចាភ្ញៀវកិត្តិយសបើសិនមកមានជាសំណួរអាចសូមលើកឡើងចាពិតជាគួរចាប់អារម្មណ៍មែនទែនបទបង្ហាញរបស់លោកវិជ្ជបណ្ឌិតបង្ហាញអំពីបច្ចេកវិទ្យាទំនើបចុងក្រោយបំផុតដែលកំពុងតែប្រើប្រាស់នៅក្នុងប្រទេសសិង្ហបុរីនៅក្នុងការព្យាបាលជំងឺខ្សោយបេះដូងនិងជំងឺស្ទះសរសៃឈាមបេះដូងចាបងប្អូនមានជាសំណួរទេចាសូមអញ្ជើញ
Brugada. Okay. So the question is, how do we treat Brugada, or what is Brugada? So Brugada is another condition about the heart, It's not blocked artery. It is not heart failure either. So Brugada is a condition where somebody has an electrical problem with the heart. It is called, first found in Southeast Asia. They found it in young Thai males. They are associated with sudden death. Okay, Brugada is an electrical problem of the heart. It's a genetic problem of the heart. These people with Brugada syndrome, the heart rhythm can suddenly go into a dangerous rhythm, go pop, 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 and people can die in their sleep, die in their exercise. This is an electrical problem. They don't have blocked arteries, they don't have weak heart. So to treat these patients, unfortunately, there are some medicines we can give to reduce the risk, but most of these patients will need a pacemaker-like device to be implanted, the one that I showed earlier on, that we call it an implantable cardioverter defibrillator, and then that's to treat them when something like this happens. So that's Brugada syndrome. Yeah, it's an electrical problem of the heart. They don't usually get heart failure or blocked arteries. Yes? How old? Blocked arteries. Okay, so the youngest person that I've got, that we had, my youngest patient who has a blocked artery and had to do a stent for a heart attack, 25 years old. Okay, most of the time, it's like 50 years old, 60 years old. But these days, we are seeing younger and younger people. Some of them is because genetically, their family has got high cholesterol. We call it familial hypercholesterolemia. So the family, everybody has very high cholesterol when they are very young. So these people get blocked arteries very early on. But we also realize that our diet is playing a big part in, we call it premature coronary artery disease. They get it earlier and earlier. So we actually advocate people these days, our health promotion board say that after 18 years old in Singapore, we are recommended every 3 to 5 years to check your cholesterol, check your sugar, check your blood pressure, in case you have all these risk factors. Thank you.
អូខេអរគុណច្រើនភ្ញៀវកិត្តិយសចាមកដល់ពេលនេះយើងនឹងបញ្ចប់វគ្គទី1ហើយនឹងមានការសម្រាប់អាហារពិសាសម្រន់ចំនួន20នាទីហើយយើងនឹងត្រឡប់ចូលមកវិញជាមួយនឹងបទបង្ហាញចំនួន3បន្តទៀតពីអ្នកជំនាញរបស់យើងផងដែរចាហើយកំឡុងពេលនេះផងដែរភ្ញៀវកិត្តិយសទាំងអស់ក៏អាចសាកសួរនៅសំណួរតាក់ទងទៅនឹងកញ្ចប់សេវាបញ្ចុះតម្លៃទៅលើការពិនិត្យសុខភាពនៅប្រទេសសិង្ហបុរីជាមួយនឹងក្រុមការងារនៅខាងក្រោយផងដែរចាសូមអរគុណហើយនឹងត្រឡប់មកវិញនៅក្នុងរយៈពេល20នាទីទៀតចា Thank you Dr. So now let's give a floor to our audience for any question. ចាសូមអញ្ជើញចាមានចាសូមអញ្ជើញបងខាងក្រោយសិនចាអាចជាភាសាអង់គ្លេសផ្ទាល់ក៏បានចាឬក៏ជាភាសាខ្ញុំសួរជាភាសាអង់គ្លេសចាចាអរគុណ
My name is Hang Lamsa. I am a medical oncologist from the University of Health Science. And, I would like to ask you for the BRCA mutations. In Singapore, do you have any, after diagnosis of the breast cancer, do you have any the BRCA mutation molecular searching before the treatment? Yes, and if so, do you treat the BRCA treatment molecular before in early stage or localized advanced stage in the first line treatment? Yes, and if so, in this BRCA mutation, do you have any recommendation for the young generation, such as their doctor, for the follow-up treatment or screening? Yes, thank you.
Thank you. Yes. Yep. Thank you very much. So nowadays, because BRCA mutation has been found to be very sensitive to PARP inhibitors, there is actually treatment benefit in knowing whether they have the BRCA mutation or not. So for women with BRCA mutation in the high-risk cancer group, and that is defined by the study as a woman with 4 or more positive lymph node, with a cancer larger than 5 centimeters, or with a Ki-67 of more than 20%, they might benefit from PARP inhibitor if they have a BRCA mutation, we would send them to our genetic counselor, who would then counsel them with regards to the pros and cons of genetic testing. And if they agree to genetic testing, then we would send the we send the blood for genetic testing. And if they do have the BRCA mutation, then we would offer them a PARP inhibitor. This also is borne true for patients with advanced stage ER positive and triple negative breast cancers as well. So mainly because nowadays there are therapeutic benefits to knowing whether they have a gene mutation or not. We do perform a lot of genetic testing. Fortunately for our group, because we have 2 genetic counselors with us, so they do make things easier because there are a lot of implications about knowing whether a person has a gene mutation or not with regards to the family as well.
ចាគាត់ឆ្លើយតបឲ្យបងណាចាអរគុណច្រើនសម្រាប់លោកពូមានជាសំណួរអីគេដែរចាចា
សូមជម្រាបសួរលោកស្រីវិជ្ជបណ្ឌិតសំណួរខ្ញុំគឺចង់ដឹងថាកុមារជាស្ត្រីដែលបានចាក់វ៉ាក់សាំងការពារជំងឺមហារីកហើយដល់ពេលធំពេញវ័យហ្នឹងភាគច្រើនគាត់ច្រើនកើតជំងឺមហារីកឧទាហរណ៍ក្នុងរាងកាយរបស់ស្ត្រីដូចលោកដុកទ័ររៀបរាប់មហារីកដោះឬស្អីចឹងទៅហើយចំពោះស្ត្រីហ្នឹងកើតប្រមាណភាគរយដែលបានចាក់វ៉ាក់សាំងហើយណាហើយស្ត្រីដែលមិនបានចាក់វ៉ាក់សាំងភាគច្រើនគាត់ច្រើនកើតពីអាយុប៉ុន្មានបាទមានតែពីរទេសូមអរគុណបាទ
Okay, his question is about the girls who got vaccination already to prevent the cancer, but how many percentage or risk that they can expose to the cancer after vaccination? And what about those who already did not have the vaccination? Like how many percentage of risk that they can expose to the cancer?
Do you mean cervical cancer?
លោកពូចង់មានន័យថាវ៉ាក់សាំងការពារជំងឺមហារីកស្បូនឬក៏មហារីកសូដនដែរព្រោះសារគាត់ធ្វើបទបង្ហាញអំពីមហារីកសូដនណាចា
យើងអត់ដឹងថាវ៉ាក់សាំងដែលគេចាក់ទៅហ្នឹងភាគច្រើនដូចជាឧទាហរណ៍ថាក្មេងៗគេឲ្យចាក់វ៉ាក់សាំងក្រោម10ឆ្នាំអញ្ចឹងទៅបាទវ៉ាក់សាំងការពារជំងឺមហារីកហ្នឹងវាមិនមែនចំពោះតែសូដនទេគ្រប់បែបយ៉ាងទាំងអស់បាទអញ្ចឹងខ្ញុំចង់សួរថាអ្នកដែលចាក់ហើយហ្នឹងមានន័យថាភាគច្រើនស្ត្រីដល់អាយុប្រមាណដែលគាត់ចាក់វ៉ាក់សាំងហើយគាត់មានផលប៉ះពាល់ដល់មហារីកសូដនហើយស្ត្រីដែលមិនចាក់វ៉ាក់សាំងភាគច្រើនកើតប្រមាណកើតជំងឺសូដនហ្នឹងប្រមាណភាគរយហើយចាប់ពីអាយុប្រមាណអញ្ចឹងណាបាទ
ចាអរគុណច្រើនខ្ញុំនឹងជួយសួរគាត់បញ្ជាក់ពីព្រោះដោយសារតែសម្រាប់កុមារបើតាមខ្ញុំដឹងដូចជាកុមារីគឺគេចាក់វ៉ាក់សាំងការពារជំងឺមហារីកមាត់ស្បូនទេប៉ុន្តែយើងសួរគាត់មើលថាតើគេមានវ៉ាក់សាំងការពារជំងឺមហារីកសូដនឬក៏អត់ចាប៉ុន្តែសម្រាប់លោកពូគឺចង់សួរអំពីមហារីកទូទៅចាចា Okay, can you clarify about the vaccination? Is there any vaccination that we can provide to prevent the breast cancer, like the cervical vaccination? Yes. Okay. I think that would be a first question first. Yes.
Oh, thank you for your question. So unlike cervical cancer, breast cancer is not really associated with viral implication. So the cause of breast cancer is usually either genetic or environmental, which can include smoking, obesity, and a lot of other factors. Especially, luckily for cervical cancers, these are associated with HPV virus. So 90 to 95% of all cervical cancers are associated with HPV. And fortunately, nowadays, there are HPV vaccines that can prevent cancer. And it's been found to significantly prevent cancer if we vaccinate women at very young, or in the teenage years or in the reproductive ages. We can actually prevent cervical cancers. So for breast cancer, we need to use a different strategy in reducing that risk of cancer. So more screening as well as reducing the risk factors, such as encouraging women not to put on too much weight and to exercise and to eat well. Yeah.
Thank you very much គាត់បញ្យល់ថាតកតងទៅនឹងមហារាជសូដនហើយនិងមហារាជម៉ូតស្បូនគឺខុសគ្នាដោយសារតែមហារាជម៉ូតស្បូនគឺឆ្លងដោយភាគច្រើនដោយសារ virus អញ្ចឹងទៅមានវ៉ាក់សាំងនៅក្នុងការចាក់ការពារសម្រាប់កុមារីប៉ុន្តែសម្រាប់មហារាជសូដនវិញគឺយើងអត់ប្រើប្រាស់វ៉ាក់សាំងទេដោយសារតែវាតកតងទៅនឹងរបបអាហារតកតងទៅនឹងការពិសាបារីហើយនិងបញ្ហាសុខភាពផ្សេងៗទៀតដែលមិនមែនជា virus ដូច្នេះហើយគឺយើងអត់ប្រើប្រាស់វ៉ាក់សាំងទេក៏ប៉ុន្តែយើងប្រើប្រាស់វិធីសាស្ត្រនៅក្នុងការការពារតាមរយៈការទៅពិនិត្យជាទៀងទាត់ចាហើយដើម្បីមើលដុំសាច់មហារាជហើយនឹងធ្វើការព្យាបាលទាន់ពេលវេលាចាចាលោកពូសុំសំណួរមួយចុងក្រោយឲ្យខ្លីដោយសារពេលវេលាយើងកាន់តែខោចហើយ
ខ្ញុំសូមសួរគាត់ថាឧទាហរណ៍នៅប្រទេសជប៉ុនមនុស្សដែលជក់បារីជាងគេលំដាប់លេខ1នៅពិភពលោកប្រទេសជប៉ុនអញ្ចឹងចង់សួរគាត់ថាគាត់មានទិន្នន័យបញ្ជាក់បានទេថាស្ត្រីនៅប្រទេសជប៉ុនដែលជក់បារីច្រើនជាងគេលើពិភពលោកកើតមហារាជប្រមាណភាគរយផ្នែកសូដន
Okay, he has another inquiry. In case you know, yes. So he have heard that in Japan there is a high percentage of women who smoke. So do you have any idea like how many percentage of Japanese women who have breast cancer? In case you know, you can share. Yeah. If not, that's okay.
Thank you. Breast cancer is the most common cancer in women in most countries. Yeah. So the incidence of breast cancer in Japan is also pretty high. I think it's probably in the region of 10 to 13%, but yeah.
Thank you. Yes. ចាគាត់មិនច្បាស់ទៅលើទិន្នន័យហ្នឹងទេប៉ុន្តែប្រហែលជា10ទៅ30% ផងដែរនៅក្នុងប្រទេសជប៉ុនដែលមានការជំងឺមហារីកសូដនចាអរគុណច្រើនចា Thank you doctor. Thank you. So now it's time for question and answer session. So if you have any question, please raise. Okay, please.
Yes, my name is Van Kieng, and I'm a medical student. And I would like to ask you that the patient that infected by the Helicobacter pylori, and now she treated already and killed the virus already, and the biopsy showed that she intestinal metaplasia. And what is the recommendation or treatment for this case?
Sorry, so the Helicobacter has been eradicated.
Yes, the Helicobacter already treated and killed the virus, killed the bacteria already. Yes, and she biopsies they show that she have the intestinal metaplasia.
Right, sure. Okay, so that's a good question. Thank you very much.
Thank you.
So, Helicobacter causes inflammation in the stomach. It causes ulcer, it causes cancer. Intestinal metaplasia, as you mentioned, is precancerous. That means that there is a possibility this patient in their lifetime will go on to be a cancer patient, that means stomach cancer patient. So what they need to do is there's a protocol for surveillance for these people. One, when we do the endoscopy, there is what we call the Sydney biopsy protocol. So that means we must take biopsy, one from the upper part of the distal part of the stomach and one from the lower part. Similar for, that's the part called the antrum, the mid part of the stomach called the body, we need to do the same, and the top part from the cardia and the fundus. So there is the Sydney biopsy protocol that we should follow. Then we will see how bad the intestinal metaplasia is, okay? Because if it's mild, moderate, or severe, then we will make a decision. Because if it's severe, then we might need to cut out that part that's called severe dysplasia, because that is definitely at some point going to become cancerous. We can do it with the telescope test before it becomes cancerous, so we can do it with the OGD or the gastroscopy. Subsequently, we risk stratify the patient. Does the patient have a family member who has stomach cancer? What is the lifestyle of the patient? If the patient is a smoker, whether the patient is obese. If the patient has a clean lifestyle, non-smoker, non-obese, no family history of stomach cancer, usually we say we will have to repeat the endoscopy in 3 years' time. Okay? if there is severe dysplasia that we cut out, then usually we'll go back and have a look in 6 months to 12 months' time to again have a look. Sometimes we also use what we call dye spray or enhanced endoscopy, where we use special lighting or something called narrowband imaging to try and look for further precancerous changes before they become cancer. So in short, there are guidelines of surveillance for intestinal metaplasia, but we have to risk stratify them first.
Okay, respond. Okay, thank you very much, Doctor, for your presentation and answering
Thank
the
you.
question. Okay, so now, ladies and gentlemen, if you have any question, please raise your hand. Please.
Thank you, Doctor. My name is Gionet, and I'm a member of St. John and also a medical student. And I want to ask you a question that you know that the old people that are like 50 or 30% that the muscle or already become weak and also degenerated. And if the retractor cuff tear happen on the all people, do you recommend them to do the operation, or that is there any risk to the operation to them, and how long does it heal after we treatment the retractor cuff tear? And also I would like to ask you, can you send us the slide presentation, because yeah, we are a medical student, we want to learn something new from you. Yeah, can I have all the slide presentation? Not only you, all the doctor too, and thank you.
Oh, okay. Thank you for your question. So I think I'll address the first part of the question, which is whether patients who are 50 years old onwards, if they have a rotator cuff tear, whether they will benefit from treatment and what benefits there are. Is that, yeah. Okay, so the main benefits of treatment, or rather the main aims of treatment in rotator cuff surgery is to help them regain function. So in shoulder, commonly what affects patients are pain, range of motion, and strength. So I would say in those cases, if any of these are affected, they should seek treatment. And if the patient especially is considered young and fairly active, so if you ask me, I would say 50 to 55 is considered pretty young nowadays, and they are fairly active, they should consider some form of treatment. So it depends on the severity of the tear and how badly the symptoms affects them, whether they should go for surgery or not. If it's a full thickness cuff tear and they have and the symptoms affects the activities of daily living, such as showering, changing clothes, eating, or even affects their work, then definitely by all means they should consider doing surgery. Surgery usually, after the rotator cuff repair, the tendon usually takes about 6 weeks to heal, which is why we require patients to wear arm sling for about 6 weeks duration. Subsequently, then they do need a lot of physiotherapy to help regain the range of motion, because as you know, after being on arm sling for 6 weeks, the shoulder will be stiff and weak. So they do need quite a bit of physio to help to get them back to normal range of motion and to regain the strength. So in patients who do fairly manual work or who have to lift heavy things for work, I would say the return to work would usually take at least about 6 months to a year. Yeah. Okay, thank you so much. Yeah.